Hi, my name is Teresa McLeod. I'm a registered nurse, and this is a presentation on why to set the goal to obtain a BSN. So a little bit about me first is that I am a associate degree nurse. I graduated from a community college in May of 2016. I was hired at Mary Immaculate Hospital, which is a Bon Secours facility, in July of that year. And when I got my new position, I was required to sign a contract stating that within 5 years I would obtain my BSN. So it kind of got me thinking as to why is it that my employer required this of me. And honestly, I know it's because, healthcare is constantly changing. And in order for me to stay relevant and up to date, furthering my education is a logical step. By obtaining a bachelor's in nursing, it's going to offer advancement opportunities, career development, and definitely a personal satisfaction, which when I'm happy with if I'm feeling satisfied, it's going to increase my likelihood of staying where I'm at, so a higher retention rate. And I know that Bon Secours values me pursuing this journey because they offer a generous reimbursement package for my tuition expenses. So I really want you to think of obtaining your BSN, as a beginning of the journey, kind of the next step on your professional ladder. So our healthcare is aging. Our population is aging in our country, and so nurses have to change. And our healthcare system has to change in order to take care of this changing population. And so the Institute of Medicine, along with the Robert Wood Johnson Foundation, came up with a report, and they titled this report "The Future of Nursing." And in it, they're calling for nurses to take a more active leadership role in the evolving healthcare system. One of the recommendations is that there's a focus on education. There was a statement in there which caught my attention. It says, a more educated nursing workforce would be better equipped to meet the demands of the evolving healthcare system. They recommend in this report that by the year 2020, 80% of all RNs will be BSN RNs. So once a nurse enters a BSN program, some of the things that they're going to be exposed to is and some skills that they're going to learn are teamwork and collaboration. Collaboration meaning we work with numerous different disciplines in our daily practice. So we're going to be exposed to what is their role, what is their scope of practice. We're going to be learning leadership and management skills and different styles. There's going to be a focus on quality improvement, on safety, the QSIN. There's a big focus on that. And that is quality and safety education for nurses, so that we are continually practicing the safest care. We're going to be taught research, how to conduct research, how to find the best evidence-based practice. And mostly we're going to be taught a questioning attitude. We want to not just continue to do things because that's the way they've been done in the past. We want to have that questioning attitude. Is this the safest? Is this the most effective way of taking care of the patient population that we take care of? So just, once we achieve this goal of a baccalaureate nursing degree, know that our opportunities are limitless at that point. If your goal is to become a nurse practitioner or a midwife or a nurse educator, those avenues are open to you. Maybe you want to become a nurse practitioner focusing in mental health or forensic nursing, or become a case manager. Those are all the avenues that are open up to us with our bachelor's in nursing. So I just encourage you to continue to be a lifelong learner. And thank you very much for listening to my presentation.